Okay, we're now going to talk about the female reproductive system, and this is part 2, and we'll discuss the perineum and answer the what questions. What are the organs of the female perineum, and what do they do? And what is the innervation blood supply of the female perineum? Hello, everyone. My name is Dr. Morton, and I'm the noted anatomist. And so this is the overview of what we're going to be covering for the female perineum. We'll talk about the perineum, the perineal muscles, perineal vascular supply, and innervation. And so let's first talk about the perineum. And so what is the perineum? It's a diamond-shaped region that's bordered by the pubic symphysis, our ischial tuberosities, and coccyx bone. So we go, there's our pubic symphysis, there's one of the ischial tuberosities, and there's the coccyx, and we connect them all. There's our perineum. It's a diamond-shaped structure, and it contains the urethra, the vaginal orifice, and the anus. Now, the perineum can be subdivided into two other triangles, the urogenital or UG triangle and the anal triangle. So let's take a line between the two ischial tuberosities, shing, like that. And then in front of that line, we have the urogenital triangle because it contains the urethra and the vagina, so the urogenital triangle. And then behind that line is where the anus is located, so they call that subtriangle the anal triangle. So there's our perineum. Now, what are the structures within that perineum? Well, first is something called the mons pubis. It's a rounded area of adipose tissue that's overlying the symphysis pubis. So there's our mons pubis, and it usually contains pubic hair. The labia majora is paired longitudinal ridges of skin that's lateral to the labia minora, and it contains pubic hair, and it's homologous to the scrotal sac in the male. And so there we have one side showing the labia majora. Now, the labia minora are paired longitudinal ridges of skin medial to the labia majora, and they're hairless. And here we have a labia minora on one side, and there's a same on the other side. Now, the vestibule is a space between the labia minora. So here are the two labia minora, and then the dotted line is showing that space in between. And the vestibule, or opening, contains, or entrance is what the word vestibule means. It contains the urethral orifice, the vaginal orifice, as well as the opening of the vestibular glands. The clitoris is an erectile organ that's highly innervated by perineal branches of the pudendal nerve. In fact, it has the highest concentration of sensory neurons in the perineum. There's our glans clitoris. Now, the clitoris is like an iceberg in that there's the water and there's the tip of the iceberg. And if you know that if you can see the tip of the iceberg out of the water, you know that below the water is where the majority of the iceberg is located. Well, the clitoris is like an iceberg in the sense that there's the tip of the iceberg, and we know that is the glans clitoris. And then you have the water line, which we have as the skin. And then deep to the water line, where the majority of the iceberg is located, just like deep to the skin is where the majority of the clitoris is located. And that includes the corpora cavernosum and the crus, which is covered by a skeletal muscle called the ischiocavernosus muscle. So here we have the clitoris. And what is the difference between the corpora cavernosum and the crus? Well, to answer that question, we look at this picture, and we can see the crus there. That part of the clitoris is anchored to the ischiopubic ramus, which is bone. It's basically where the union of the inferior pubic ramus and ischial ramus meet, and so it's anchored to bone. Whereas the corpora cavernosum is not attached, and so it is it's the part of clitoris that is free going into the glans clitoris. Now, the bulb of the vestibule, shown there in pink, is also erectile tissue, and this tissue flanks the vestibule right beside the urethral and vaginal openings. And it is covered by the bulbospongiosus muscle. So there's the bulb of the vestibule on one side coursing up, and then they come together and they enter into the head of the clitoris. So erectile tissue, then, is a collective term that describes tissues that fill with blood during sexual arousal. This includes the clitoris and the bulb of the vestibule. So here's the glans clitoris, the corpora cavernosum, the crus, and the bulb of the vestibule. All of those are erectile tissues. all of which engorge with blood during sexual arousal. Now in this anterior lateral view, you get a little bit better view of the three-dimensionality of it, where there is the glans clitoris and the head of the clitoris, and then coming down on each side is a corpora cavernosum, and then the anchored part, which is the crus. And then here we have this bulb of the vestibule that you can see flanking. Both paired bulbs are flanking the urethral and vaginal openings. There's erectile tissue. Now, erectile tissue, I will say, whoops, sorry about that. I'm just going to do this one little part again here. I just wanted to mention this because this erectile tissue is innervated by parasympathetic nerves, and the parasympathetic nerves from pelvic splanchnics are what cause blood vessels to dilate, to fill this tissue, to cause them to become engorged and then erect. And so that stimulation, which we'll talk about in another video, results then in a reflex, which is parasympathetic innervation of blood vessels in this tissue to cause the blood to leak into and cause this tissue to become erect. Okay, another structure is called the greater vestibular or Bartholin glands, and this is a homologous structure to the male bulbourethral gland in that it secretes mucus into the vestibule to lubricate the vagina during sexual arousal. So there's the opening of the greater vestibular gland, and then there's the gland, and you notice that it's dotted, which shows that you're seeing through the skin to see where it is. All you can really see is the opening in surface anatomy. Yes, so the greater vestibular gland, because the secretions go into the vestibule. There's the perineum, the boundaries, triangles, and structures within it. Now let's talk about perineal muscles. Now the first thing about perineal muscles to mention is this. Perineal muscles are skeletal muscles. I'm going to say that again. They're skeletal muscles, which means they are voluntary. You consciously control the contraction of these muscles within the perineum. Now, it seems a little bit odd. It's not quite like, hey, I can contract my biceps and bend my elbow, or contract my quads and straighten my knee. But you can contract these perineal muscles and stop the stream of urine, or stop a bowel movement, or feel these muscles and the tension in the perineum. During orgasm, these muscles rhythmically contract. And so they are skeletal muscles, and they're voluntarily innervated, or they're voluntarily controlled. And the way that you control them is through innervation of the pudendal nerve. So perineal branches that go to the perineum from the pudendal nerve, innervate these muscles. And so the ischiocavernosus muscle is the first one we'll talk about. It arises from the ischiopubic ramus. And so ischio for ischium, and cavernosus because it surrounds the corpora cavernosum of the clitoris. So here we have the ischiocavernosus muscle on both sides. And on one side you see pretty much the length of the muscle, and the other side you see it go up and then it stops. And it stops because in this illustration it's cut. But there you can see the crus and the corpus cavernosum. And that's where, of course, the muscle is surrounding those which are part of the clitoris. And this muscle, what it does when it contracts, it helps to keep blood, it helps to first rhythmically contract during orgasm, and also its contraction helps to compress the erectile tissue. And there you can see the erectile tissue deep to the ischiocavernosus on the other side. Now another muscle is called the bulbospongiosus muscle. And so there's the bulbospongiosus muscle, and it surrounds and compresses the bulb of the vestibule. You see the bulbospongiosus, most of it on that side, and the other side it's cut. But you can see how it would cover the bulb of the vestibule, that erectile tissue. So it surrounds and it compresses it during erection, and also rhythmically contracts during orgasm. And you can see the bulb deep to the bulbospongiosus on the right. We also have the superficial transverse perineal muscle. This muscle supports the perineal body. So there's that superficial transverse, because of course it's in the transverse plane, perineal muscle. And there's our perineal body. And why? And for this one, for my students especially, if you can just know you can identify it, it's a good landmark. That's the main thing I need to know. But the perineal body is an interesting structure because there's the perineal body, and it's a fibromuscular mass located in the center of the perineum between the anus and vagina. And it's an attachment site for the superficial and deep perineal muscles, as well as levator ani and external anal sphincter. So there's our perineal muscles, and there's the levator ani, and there's the external anal sphincter. And you notice that you can't quite see the levator ani, but the perineal muscles and the anal sphincter you can see where they all come together in that fibromuscular mass. And now this is important because if you have a tear, say during childbirth, that goes from the birth canal, that vaginal canal down, and it tears into this perineal body, you now weaken this area, and a number of muscles are then affected because they don't have the attachment support that they should. And this is what could end up happening with creating fecal incontinence or urinary incontinence or dissatisfaction during sexual relations. So let's do a little bit of review, shall we? So here's the perineum. There's the glans clitoris and the labia minora, and there's our ischiocavernosus and bulbospongiosus muscles, as well as the superficial transverse perineal muscle and a deep transverse perineal muscle, and there's our external anal sphincter. And I put pelvic diaphragm, that what you see there is the levator ani portion of the pelvic diaphragm. And then what we're going to do is take a scalpel blade and then cut around this muscle and go shing. So now we see deep to that tissue, to the muscles. So now we can see there's our glans clitoris, and we can also see the corpus cavernosum on both sides. And then we can see the crus, and then we can also see the bulb of the vestibule on both sides. And then we have the greater vestibular gland there. So there's our perineum. So now that we've done the perineal muscles, let's go on to the perineal vascular supply and perineal innervation. So the pudendal nerve supplies the somatic innervation to the perineum. And so it arises from the S234 ventral rami, and it courses, as it courses, it exits the pelvis inferior to the piriformis muscle, and then it traverses through the pudendal canal on the deep surface of the obturator internus. And it does both motor and sensory. Its sensory supplies sensory innervation to the perineum. Now, at the top, you see it says pudendal nerve, somatic nerve. What that means is it transmits somatic sensations, which includes pain, temperature, touch, vibration, proprioception. All those types of somatic sensations are conveyed in the pudendal nerve. It also supplies motor innervation to skeletal muscle, the perineal and pelvic muscles. So here's the pelvic hemisection, and so let's take a look at the S234 ventral rami anatomy. So there's L4 and L5 ventral rami, S1, S2, S3, and S4. And some other anatomy to get our bearings is that there's our sciatic nerve, which is the major contributions from the L4 to S3 ventral rami. And then there's our piriformis muscle that you can see deep to those nerves. And the levator ani muscle, with on above and below you can see the obturator internus muscle. Well, levator ani muscle with the coccygeus, those two make the pelvic diaphragm muscle. And then there's our pudendal nerve and internal pudendal artery. So if we zoom in a little bit more in that one, look way up in there. And there we've got this little fascia on the obturator internus that's called the obturator canal because it's fascia on the obturator internus. And the eponym is called Elcock's canal. And so if we see branches from S2, S3, and S4 ventral ramus, they form the pudendal nerve. They course over the ischial spine and then course within the obturator canal en route to the perineum. There's our pudendal nerve. Now, just for completeness sake, there is our internal pudendal artery, and you don't see the internal pudendal vein, all coursing in the obturator canal as well. So the pudendal nerve, I want to reiterate, is a mixed nerve. It transmits both sensory neurons and motor neurons. So let's do that. So first, let's take a look at sensation. And so in this perineal view, we can see where the pudendal nerve enters the perineum, and all of those branches highlighted are showing the perineal branches for pudendal nerve to the perineum, and it supplies basically all tissues within that diamond-shaped region. And it supplies somatic sensations, so pain, temperature, touch, vibration, proprioception. So from the mons pubis, the clitoris, the urethra, the vaginal canal, the anus, labia majora, the labia minora. And to highlight again that the clitoris has the highest concentration of sensory neurons in the perineum. And so highlight the whole perineum, but the highlighted nerves are only doing half of it. The contralateral side that are not highlighted will do sensory innervation to the other side of the perineum. Now, motor innervation. The pudendal nerve provides voluntary motor innervation to the perineum and the pelvic muscles. So we then highlight, and some of those perineal pelvic muscles that are skeletal muscles again are showing the ischiocavernosus muscle, bulbospongiosus muscle, superficial transverse perineal muscle, levator ani, and the external anal sphincter. So those top three are going to help contract and compress erectile tissue. And they also support the perineum, and they rhythmically contract during orgasm. In fact, all of these muscles do that. The levator ani muscle is this hammock-like muscle that supports the pelvic cavity, and the external anal sphincter is a skeletal muscle that restricts bowel movements until you voluntarily want to go number 2. All right, so let's talk about blood supply now. The internal pudendal artery is the supply to the perineum. It arises from the internal iliac artery, and it exits the pelvis below the piriformis, and it courses in the pudendal canal, and it supplies the perineum. So here's this pelvis hemisection image, and there's our aorta, which bifurcates into common iliac arteries, which gives rise, whenever you see the prefix common, you know it's going to have branches. In this case, it's an external and internal iliac branch. And off the internal iliac artery is this branch called the internal pudendal artery. And pudendal, because it goes this prefix, the word pudendal means things you should be ashamed of, which is what the derivation is. And it goes to the perineum, which is all the things that in centuries ago, unfortunately, they said these are parts of the body you should be ashamed of. That's where the word pudendal comes from. There's our pudendal nerve and internal pudendal artery. And there's all those structures. So if we now zoom in a little bit more and we see that obturator canal, let's follow it down. There's our internal iliac artery, our anterior division, and there's the internal pudendal artery that then sends and courses over the ischial spine and then enters and traverses through the obturator canal, and the internal pudendal artery then supplies the perineum and all the erectile tissues, skin, muscles, and so forth. So here's the perineal view, and there's that internal pudendal artery, and it supplies everything within that diamond-shaped region. So the clitoris, the urethra, the vagina, and anus, and so forth. And because the clitoris and associated erectile tissues needs blood to become erect, these are the vessels, the arteries that supply it. But then all the other things, just like muscle needs blood supply, the skin, and so forth. And how do you drain, get blood from the perineum? Well, branches from the internal pudendal vein will then come from this region, drain into the internal pudendal vein. So when erection then subsides, or when blood is just draining from regular skeletal muscle or the skin, blood courses through branches, the perineal branches, to the internal pudendal vein, to the internal iliac vein, common iliac vein, IVC. So here's now the female reproductive system perineum in a nutshell. There's a picture of the perineum with all the different structures from clitoris, labia minora, majora, and erectile tissues, the bulb and the clitoris, as well as the skeletal muscles, ischio and bulbospongiosis, which these are then supplied by branches from the internal pudendal artery, or they're innervated by the pudendal nerve that arises from S234. Now I will say this, the erectile tissue is not innervated by the pudendal nerve. It'll be innervated by parasympathetic nerves, which will be shown on the next video. And that, my friends, is the female reproductive system, perineum, in a nutshell.